Hi, I'm Helena and I manage the Advanced Care Planning Program here at Alfred, and I just wanted to give you a little bit of an update on some key changes that are going to be happening across Victoria and here at Alfred Health. And one of them is the Medical Treatment Planning and Decisions Act. Now this is new legislation that's coming into effect on the 12th of March this year. This new act will take place over the Medical Treatment Act and parts of the Guardianship and Administration Act. And this act really provides a framework for decision making for patients that don't have capacity to be able to make their own decisions. The act applies to all health professionals. So whereas in the past the Medical Treatment Act was much more focused towards just doctors and providing consent, this applies to all registered health professionals need to gain consent from individuals before providing medical treatments. So under the new act, there's a couple of things that individuals will be able to do. One of them will be to complete a legally binding advanced care directive, and the other will be to appoint a medical treatment decision maker. So none of these things matter if the adult has capacity, because if the adult has capacity, then we would go directly to them and ask for the consent. This is when the patient no longer has capacity and we need to be able to make a medical treatment decision. How do we know if somebody has decision-making capacity? Well, they need to be able to understand the information that we're providing them. They need to be able to retain that information in order to make the decision themselves. They need to be able to use information to weigh up the benefits and the burdens of a medical treatment, and they need to be able to communicate the decision that they're making. If somebody can do these things, then we have to assume they've got decision-making capacity for the decision that's at hand. Decision-making capacity is specific to circumstances, so we would need to make that assessment for every time we need to get consent and every time somebody needs to determine whether the individual has capacity. If it's an emergency, we can provide medical treatment without gaining consent. Obviously, emergency being when treatment is required to save somebody's life, prevent significant harm or alleviate distress, or it's a matter of urgency that we provide them with that treatment. We generally say within, if it needs to be done in the next 4 hours, well then it's going to constitute a matter of urgency. So advanced care directives are going to have two types under new legislation. There will be an instructional directive and a values-based directive. Now, an instructional directive is the legally binding part, and that's clear binding instructions as to what the individual does or doesn't want. The other part is a values-based directive, and that's really where a patient can outline their values, their preferences around what they do and don't want. That would be more around if I get to the stage that I can no longer communicate and I'm stuck in a bed all the time, I wouldn't want any life-prolonging treatments in that situation. That's going to be a values directive. An instructional one is a clear instruction: I do not want CPR in any circumstances. All advanced care directives now need to be signed by a doctor, they need to be witnessed by another adult, and they need to be signed by the patient themselves. Patients can also appoint a medical treatment decision maker. This is somebody who's going to be able to make decisions for them only when they can no longer make those medical decisions. Now, the Act sets out a hierarchy for how we determine who is somebody's medical treatment decision maker. And the first one is obviously if someone has been appointed under the new Act as a medical treatment decision maker, or if someone is appointed a medical enduring power of attorney. If they haven't done either of them and VCAT haven't appointed them a guardian, we then need to follow a hierarchy to determine who is their medical treatment decision maker, and that starts with looking to see whether they've got a spouse or a partner. If they don't have one of them, we're looking for a primary carer. If they don't have one of them, we're looking for their oldest adult child. If they don't have one of them, their oldest parent, and not one of them, we're looking for their oldest adult sibling. If they don't have any of them, and they don't have an advanced care directive, then we need to gain consent if it's a significant treatment through the Office of the Public Advocate. But in most circumstances, we'll be able to find a medical treatment decision maker as per that hierarchy, and then they would make the medical treatment decision on behalf of the patient. They would need to take into account the values-based directive as well. So where do you find these forms? If a patient's already presented them to hospital, we will have put them onto their medical file, and they will be in the clinical notes in the legal folder. There will also be an alert up on the banner bar that says Advanced Care Plan, but you need to go into the legal folder to find these documents. If someone gives these documents to you when you're on a ward, take a copy and put them in the paper file so that once they're being discharged, they can be scanned into that electronic medical record on PowerChart.